Okay, do we want to start then? We good to
Yeah,
go?
yeah.
Okay. So the main reason we're meeting this morning is just so we can, I can update everybody on some of the things that we've been working on just from the building perspective and talking about, some of the ways that we're looking at recreating our work environment and making it, we're starting to move into what I would call sort of the next phase of the reopening, if you will, of the building. And so we put together a plan. Donna and I have been working together on it, and we've been looking at each different office and, sort of evaluating the basics of each office to try to, just make sure that what we're looking at makes sense, and sort of the things that we're contemplating doing make sense given, the CDC guidelines and the other things that are out there and in place to be able to accommodate people within the building at some point. And I just wanted to emphasize that because the stay-at-home order expires on June 15th, the next one. And we know that state and local governments are actually exempt from the order anyway. So in theory, we could open tomorrow and let all the public into the building. But of course, that's not what I'm thinking. I'm thinking of a phased approach and, taking steps at a time to be able to gradually, hopefully get to that point of having the public be able to access us within the building. So one of the models that we've been looking at is the town of Londonderry, because they are actually, there's a few models out there, but the town of Londonderry has been sort of ahead of this. In the first thing they did was basically, and they're opening June 15th and I'm just using that as one example. There are probably others out there that people can point to. They're opening up their town clerk collector space for public to come in and pay bills and do things like that. But they've also, they're all the other offices that they're operating, they're going to start with by appointment, which when I looked at this in terms of the town offices and our administrative offices seemed to make a lot of sense to me. So we could definitely structure a situation within the building where people would be able to call in advance, and then we could control people coming into the offices better than, if it was just a walk-in situation. So that's sort of an example of a limited reopening, not a full-blown open the doors, Katie bar the door and everybody gets to come in. It's a bit of a phased approach, and it's something that, I'd like to talk about and just take questions from people about that. So before we go further on that, so what we did is we circulated out this plan to everybody to look at. And then what I'd like to do is, and really the foundation of the plan is based on having adequate signage in the building, evaluating each office, like I said, in terms of like the ability to social distance, hand sanitizer at all the different locations. And then obviously, and I'm sure we're going to talk about this a little bit today, the cloth face coverings and how those apply to the building at large, and how we would interact with people within the building when we needed to, if we were inside the 6 feet. Because a lot of the rules on the guidelines, the universal guidelines, and whether it's workplace, sports, you name it, the key component seems to be if you can social distance, you're in good shape to not have to have a mask. But if you're within that 6 feet, the recommendation is that you're in the best situation if both people are wearing a mask. So that's something we've got to sort our way through. So I think that's an overview. The plan also calls for, what we're thinking about is for people that come in the building that would need, they're kind of the lost souls. They just wander in here. Again, that's more sort of down the road if we were to open the door, but we talked about having a banker's rope set up at the bottom of the stairs so that people couldn't just kind of freewheel and come up the stairs and go into any office they wanted unannounced. They'd have to actually call in, and then somebody would go down and greet them and sort of bring them up to wherever they're going to go. And that was an idea that we came up with to sort of control the traffic flow within the building. So I think those are the big things. Hopefully everybody's had a chance to look at the plan. What I'm hoping is to get people's feedback by Friday on this. So if you have the chance to look through it and you have any concerns or questions, this is sort of a checklist type plan. It's not in its final form. It's not in a narrative form, but it sort of addresses each individual workspace, like I say. And if there are things that are not there that you'd like to see in your workspace, by all means, make sure that Donna gets that feedback so we can incorporate it into the next draft of this and look at it, holistically and that sort of thing. So that's my kickoff. And Donna, I don't know if you want to take the next step or address anything particular before we get to Q&A on this and discussion.
Well, I have had conversations with different people in the building, and Andy Kohler and I have discussed also different things because, the town clerk and tax collection area, we're going to be the busiest areas. And that's how some of these items got on the plan, is through discussions with other people, also what other towns are doing, like Russ mentioned. But whatever ideas people have, it's better for us as a group to work through this so that we have the best possible scenario going forward. If someone wants to chat about it, that's fine. We can do that. Or if you just want to email me, that's fine also. Or if you have concerns also.
So,
this is some uncharted waters.
Yeah. So, in terms of Bob, are you, you can hear me, right?
I hear you.
Do you, since we have so many people, does it make sense for people to raise their hand and then like you call on them like you would in a regular, like a town meeting type of thing?
Yeah, I think that's fine. If you guys, if you don't see already at the bottom of your screen a raise hand button, if you press the participant button and then go over on your right, on the bottom right, there should be like a raise hand button. It's kind of like the digitally raise your hand. You could press that if you want to, ask a question or something, because it's hard for everybody to see who's talking. So I see Darren has his hand raised. So maybe Darren, you can unmute yourself and.
I know Dover, at least according to Barafaldi, they're doing a one-way thing. I wonder if we can't ask anybody who's not handicapped to go out the exit door, so they don't have to walk back past people.
Mm-hmm. Yeah, we're the answer to that is we're looking at that. We had a conversation yesterday, Donna and I did, about use of the back door, and so we're looking at that as a potential option. That's on the table for discussion and kind of further review. So it's good. It's a good point. I just wanted to say too, I mean, one of the things that's driving this is that, keep in mind, like when we first went down this road, March 16th, March 15th, even before that, there are a few things that everybody experienced at that time. And one was, of course, my interaction with various community constituencies, the hospital, Riverwoods, things like that, PEA, and getting a sense of, at that time, we were dealing with a lot of unknowns at that time, what the hospital capacity was, what the contagiousness was, what the virus was. So a lot of those decisions obviously were made, and they were good decisions, I think. And they were made with the idea that, we had to maximize our protection in a situation where we really didn't have testing available. We didn't have certain things that were available to us. Now, if you look at it 2.5 months later, 3 months later, we do now have data, so we know how many cumulative cases there have been of COVID-19 in the SAU 16, and I think it's somewhere around 37 altogether since March, since the tracker started, the first case in the state. So if you look at, and that's cumulative, by the way, that's not active cases. There are no cases right now in Brentwood. There are none in Kensington. I don't know that there are any in East Kingston. So from a perspective of number of cases, plus we have data that shows us, on a county basis, how many cases there are, and also the amount of tests being administered has gone way up, and everybody can get a test now that needs it, and quickly. So from that perspective, I just wanted to put that out there so everybody understands, like, we know more today than we did 2.5 months ago, for sure. We know surface contact is not the same issue that it was thought to be a couple of months ago. And reinfection, we talked about that. If everybody has read that story from South Korea about the reinfection, and they went through that process and tried to figure that out, and turned out it was more dead virus than it was an actual reinfection, what you would call a reinfection. So I'm not downplaying this at all. I think we need to be vigilant and follow the guidelines and make sure that we're doing best practices and all those kinds of things. But I just wanted to give people a positive sense of sort of where we were a few months ago in my mind versus where we are today. So I think we're definitely in better shape today than we were. And the virus is going to be there. It's going to exist. It's going to live. And as things open up, we're just going to have to, follow our best practices and make sure that we have all the proper planning and precautions in place to limit exposure as much as we can, just like we have been. And I will say this too, public safety, public works, library, ourselves. I mean, I am very grateful for the fact we have not had one positive case in the town, not one. We've had a few people that have had tests done. They've had antibody tests done. People that have thought they had the virus that came up negative. So, as an organization, we've done very, very well to, whatever you want to call it, limit the spread, flatten the curve, do what we need to do, and stay out of harm's way. So I'm very happy about that. That's good. And I think going forward, like I said, as long as we're continuing on a good path, we'll be in good shape. All right, with that, more questions.
Leanne has her hand up next. She doesn't look like she has the microphone plugged in though, so.
Come over here.
Yep, that's what I'm doing.
Hang on, she's coming. Hi, I'm wondering about how we're going to handle the handicapped people. If they go out the back door, there's no ramp.
Right.
And the elderly.
Yeah.
And the elderly. That's a long walk for them.
Mm-hmm.
Well, as far as handicapped people, we would have to allow them to come in and leave from the front door. If the front door is locked, they would have to call in so they could be let in for an appointment and then let out afterwards. If we do go with the back door, the back exit door, coming in and out, then some of the things that we're going to do to let the public know how they're going to be received here would be, we would post how we want them to come to the town offices on the website and on social media, so they know what to expect. And if we do have them come in and out the back door, we could also let them know they can park out back there in the municipal parking lot, so that this way they're not having to walk around the whole building.
Well, I don't think that's gonna make any difference. If they park out front, they gotta come, they're gonna exit the back. If they park out back, they gotta exit, they gotta enter in the front. So that really doesn't make any difference where they park.
No, no, if they, as far as handicap, yes, they'll come in and out of the front by appointment. But everybody else, all the rest of the public, if we do go with the back door, the back of the building door, the public would enter and exit out of the same door, and they could park out back there, so their vehicles out back, they wouldn't have to come in the front.
So yeah, those are definitely things we're gonna have to, that's one of the decision points, is access and egress and figuring that out. Those are good questions.
Andy, you were up next there.
Leanne already asked my question, so that's okay.
Alrighty, Pam is up next.
Doug?
Yes.
Oh,
Go ahead, Ken. You go.
I wanted to let everybody know that social distancing floor stickers have been ordered, not only for this building, but for the library, for DPW, and if the police department wants them as well. I've been working with Jeff on that. Also, we were working on having the foam things by the back door and the front door. So as people come and go, they have that available as well. Also, I have a volunteer who has made 60 cloth face masks that are washable. So if you know of any elderly or anybody that needs any of those, certainly send them to me, and I have them up here. I can meet them at the front door and give them to them.
All right, Doug, you could. You're up next.
Yeah, just a couple of things. Talking about the back door, the handrail system in the back of the building is not to code. And I would hesitate to see the public utilizing that set of stairs because the handrails do not meet code. And if, God forbid, if somebody fell and got hurt, I don't know how we would deal with that, but I would discourage any use of the public using the back, especially elderly people. Well, like 65 and older. And and as far as upstairs here in our office, Tom was up here this morning and measured. I requested a couple weeks ago to put a spit shield up at our counter, and instead of using the sliding glass doors, we're going to keep the sliders there. But he came in and measured for the spit shield this morning, so hopefully that will get installed here properly. And I do, like Barb and I have talked, and Dave, about these people calling if somebody needs a building permit or something like that, that they would call ahead or call from the front, and we would come down and assist them. That way there would only be one person up here in our lobby. So we think we can deal with that the way you have drafted this for our purposes, but that's just for us.
Yep.
So I'll let others discuss their ways. Thank you.
Thanks, Doug.
Doreen's up next.
Oh, all right. I just had questions about whether or not the doors are going to remain locked at the town offices because it's by appointment. I have over here, the concern is we have a business that runs the Chamber of Commerce, and I want to work with them and make sure that we're all on the same page, because their hours are very inconsistent, and often we get people coming in asking us where they are, or asking things that they would answer about different businesses or things to do. So we do get a fair amount of foot traffic from the street. We have a lot of people come in for motor vehicle, believe it or not. This is where they can register their car. I'd really like to keep the front door locked, but if it's not possible, Jeff is working on a buzzer system for finance so that we can buzz in someone we're expecting, an employee only, but not just have people randomly walk off the street. And, we've had people ask to use our phone. I'd really prefer to limit the amount of contact in this office if possible.
Sure. Okay. Thank you.
Yeah, thank you.
Dave looks like he's got his hand raised.
Thank you. Can anyone hear me all right?
Yeah.
Okay.
Yes.
Just Doug answered my question when I raised my hand about the code compliance of the stairs. I was wondering about the railing and rise and run. Rise and run, it seems pretty comfortable, so it's probably okay. But I was thinking maybe instead of this, just a suggestion, instead of a one-way, you could place some signage. May not work when it's real busy, but like when people leaving, like wait here and allow others entering to pass. So, you kind of move them over here, they pass, they see the ways clear, and then they can enter. Because I think that's what we're worried about with the one-way is people crossing each other. So you can kind of direct them when they get outside to the right by the elevator, they wait until it's clear to pass. And then I was talking to Doug and Barb yesterday about the rope at the bottom of the stairs. I can't like they seemed okay. How about maybe at the top, at the bottom of the mezzanine stairs? So instead of people waiting down there where people are coming and going for the tax collector's office, maybe they come up, and then have signage everywhere, like building permits only, finance, no, vehicle registration across the street, or, because people look at that thing downstairs and just see the departments, and then they go in and ask Janet where everything is, or come up to ask us or town clerk. So just really good signage directing people, where the services are.
Yeah. Okay. Good thoughts.
Andy's got her hand raised again.
So Russ, when you were talking to Londonderry, did they already open their building for town clerk traffic and tax traffic?
The 15th of June, they're doing that.
They're gonna open, how are they gonna do it? They're just gonna open the doors and let them come in, or?
I believe so, yeah.
Okay. Just wondering. Okay.
Yeah.
Kristen has her hand.
Oh, sorry. I just want to say Londonderry, public walk-ins for the clerk and tax collector's office, but all other departments are by appointment only.
Right.
Okay to go?
Yep.
So I had a couple questions about, so if it's appointment only, is it staff's job to enforce the public using masks, and do we have the ability to refuse to meet with someone if they won't wear a mask?
Yeah.
So that's one question I have. I have a couple of others. Do you want me to just run through them and then we can talk?
Well, with Londonderry, they will be refusing to wait on someone if they don't have a mask or some type of face covering.
Okay. And I know you had said in the plan that cloth masks would be available for staff. Would we have a supply that members of the public could use at the door if they came without one?
I would have to check with James on that. James has been in touch with me also to get head counts of employees for different departments regarding masks also. So I will check with him regarding masks for the public in case someone, comes to do business and doesn't have one.
To the first question, the answer is going to be, in my estimation, yes to that. I mean, I think we can enforce that rule within the building and just tell someone we're not going to. I mean, it's hard to predict what people will do. You know, who knows? Maybe they'll storm off mad, but we will stick to that and say if you're not going to do it, we're going to reserve our right to say we're not going to meet with you. So, and again, if they're paying a tax bill or they have a question or whatever it is, I mean, I would hope that people would be, again, I'm sort of following that basic guideline again, like we talked about at the very beginning. 6 feet is, you're in good shape, right? It's not really an issue. You social distance, it's appropriate, your physical distance. It's only when you're getting closer that you want to take that step of the cloth face covering. So, you know, we're going to have to work our way through that process and just, you know, because we all deal with different interactions, right? If somebody wants to sit and meet with you, you know, my suggestion is going to be to use the wheelwright room as a sort of a neutral site within the building where you can go down and sit down with someone if you need to for extra time to go through a particular issue with them. My recommendation would be to leave the office, go down there, get what you need.
I don't want to.
Both people have masks and make it as safe as possible. So.
And
So
then the
will
other
the-
question, oh, go ahead.
I'm just curious, to the wheelwright room being available?
The police officers are in the wheelwright room until the 12th doing their training.
Got it. Thank you.
So Kristen, did you have another question too?
Yeah, sorry,
Yeah.
just the last
That's
question
okay.
was about the photocopier. You talked about having it in the hall, and I was wondering if something like the Novak room or something like that, where members of the public aren't passing by, could be better.
Good thought. Yeah, we can look at that. That's a good idea. That and the idea of moving the copier into the hallway was sort of to promote the social distancing and give people an idea of, you know, not that we want to keep everybody apart, but that it would promote that more, you know, by doing that. So that's a good thought. Thank you.
I'll jump in with a question if you don't mind. Kind of on the topic of masks, I was wondering what thought has been given to, you know, more when's the expectation for staff to be wearing masks? Because, you know, it's all good and all to say that we should only wear them when we're under 6 feet. But, you know, you leave your office, you go into the hallway, you don't expect to meet anybody, but you might just run into somebody. It's too late. You don't have your mask on. So, I mean, I've heard other recommendations from other places that, you know, that you're kind of not wearing a mask when you're at your own desk. But when you're leaving and you're in any public space where you could encounter people, whether they're there or not, you should wear a mask. You know, that makes me feel more comfortable. And also, if the public sees us walking around without masks on in the office, even if we're not near people, they're going to be like, well, we don't have to wear masks either because they're not doing it. They're setting, you know, a bad example or whatever. So I think that should be thought about as well.
So I think, Bob, you raise a good point. I mean, there's a lot of sense to be made from that comment. And as we sort of think this through and put our plan together, you know, in a more formalized way, I think that in a scenario where the building is wide open and that you could encounter anybody in a common space, I think wearing a mask makes a lot of sense. I see it as more being, we've all gone to the store, right, since this started. I presume that most of us are wearing masks in the stores as they're, you know, promoting and want people to do. But think of it like driving in your own car, right? You're in your office. It's kind of like being in your own car, and you wouldn't wear the mask in the car. You know, you don't have to do that. But if you're out in a common space and in a store around other people, you know, that's the right thing to do. So I would hope that we would follow suit and do the same thing.
Has her hand raised next?
All right, I'll jump in. Russ, this is a question for you. Have you heard anything from Portsmouth? I understand that Portsmouth opened on Monday.
Not yet. I have not, but I'm going to follow up and get some information on what they're doing.
Doreen has her hand raised.
Yeah, just a quick question. Does anybody know if the town will have the ability to offer a paper mask to people that come in without a mask? Because I'm going somewhere today where they've, given me instructions about waiting in the car, calling when I get there, and that they're going to be offering me a mask if I don't have one, a disposable mask.
That's, I'm going to be checking with James on that to see what he's getting in as a shipment.
And the other question I had, I mean, it doesn't really deal with my office, but it just got me thinking about the coffee filter thing. I was just wondering, I don't know what the expense is, but when you go to the movie theater, it's a solid metal piece that's put in that hole so that it would be really more of a shield than like a piece of paper.
Okay.
Mm-hmm.
It would look more professional too, but I just thought I'd
And
mention it.
where did you see that, Doreen?
When you go to the movie theater, they have like the holes, but they talk, it looks like a speaker, but I don't know. I just think you can hear both ways, and it's metal. It's a round metal piece that goes in their glass.
Oh, you mean like generally? I was going to ask you, are the theaters? I almost
Oh, no,
wanted-
I don't know. I've not
open
been
to
in a
the go.
long time. Yeah.
I got a haircut. I can relate to that, but
Yeah.
okay.
So
Yeah,
I
we can look at that.
have another question. Oops, sorry. Maybe I'm not doing it right here.
Rachel's got her hand up. Dave has his hand up. Darren's got his hand up.
Where do I put my hand?
My hand was up only to say that Doug didn't know how to do it right, and he has his physical hand up. I know.
Well, I'm trying to find, I just don't want to lose the screen here, so. Oh, here comes Pam. So actually.
All right, let's see here.
Participant?
Yep, click on that.
Yeah.
And then right here where it says
Yeah.
raise hand,
Okay, got it.
we're good.
Thank you. Okay, Pam straightened me out. Thank you, Darren. So can I
I got a
ask?
question. Was anybody using Zoom before coronavirus?
So,
No.
Anybody?
No.
Darren, you were? You used it before? Wow.
Yeah.
oh, actually, I was on it. I was an invite. My Sherm's daughter uses it for birthday parties. Her daughter's first birthday was an ice storm a couple of years ago, and we used Zoom to talk to everybody because we couldn't get there for the birthday party. So that was kind of cool.
Neat. So most of us are newbies still. All right. So let's, Bob, why don't you moderate the questions again?
Yep.
You're the
Rachel's
raised
got her hand raised.
I had a question about the bathrooms. Can we keep those closed to the public? Because I don't know if we don't have time to monitor who's going in and out and wiping them down all day.
That's a great question, and that's on the table for resolution. I think that's a legitimate issue, and I don't know. We're gonna have to kind of go through our ability to do that and how we might deal with that particular issue, and that's an issue in a lot of workplaces that has been raised in a lot of different ways. So we'll look at that.
Dave has got his hand raised.
Yeah, just, I guess a question. Like the Londonderry Town Hall plan to reopen to the public seems really thorough. Maybe it doesn't address bathrooms, but it addresses, like Bob's comment about masks, requires employees that must wear masks if they're in the public hallways or any public spaces when they travel back and forth. If they're in their office by themselves, I think they can take it off. But are we looking at this as the model, as kind of the starting point? Because I really liked what Londonderry put together.
Mm-hmm. Yeah, I think we they were pretty quick out of the gate with theirs. Laconia is another place that is open as well. And as Pam mentioned earlier, Portsmouth opened Monday in some fashion. So I'm in the midst of tracking down their guidelines if they have them to kind of compare them to Londonderry and see what the lay of the land is there.
Aaron has his hand raised.
Me? No, I don't.
It shows on the screen, you
Oh,
do.
Maybe it's still
I
raised.
did that before just to tell, so you could talk, Doug.
Gotcha.
Thank you, Darren.
And Doug, your hand is still raised. Do you still have a question?
Yeah, well, it's more of a comment. On the copier, I noticed on the draft plan, there was something about the copier. And seeing that we're able to get reimbursed for COVID stuff, would it make sense to get another copier and put in another location? We get a lot of traffic from other departments that come in here and use ours. So rather than move the one we have, which is all connected and with cables and stuff, could we just get another copier and put it out in the lobby area on the second floor? It would be reimbursed for it anyways, right?
Doug, if you remember, at one point, the copier for the second floor was over against the wall next to my door.
Yep.
Remember back when we had that? So we were thinking of possibly, if we can, get another copier to put there so that this way
Yeah, that was my
reduces the traffic.
Yeah, so I guess that's my question is, can we do that?
Yeah, that's on the second part of the second part of the plan, second page under planning building.
Yeah.
So
Yes.
We've put that on the table and we're going to look at that in context to see if it's something we can put in for. And I'll talk to Eric Wilking about that, see if it can be FEMA reimbursed, or we've already chewed up most of our gopher allotment, at least at this point, about 350,000. So there's probably a little bit left that we can use from that. And I think the answer is yes to that question, that we could get reimbursed for it, but we have to confirm that from the funding source people.
Thank you.
Andy Swanson is up next.
Yes, as we look at these other towns and how they're doing it, are we looking at the fact of how their physical buildings are laid out? Because I think Exeter just has some unique issues, like everything's unique, but Exeter is particularly challenging, I think.
I mean, I think look, there's 231 towns in the state. I think if you went to any of the various town offices around the state, you could find challenges. So I'm looking at it through that lens. Like, I don't think we're unique amongst the 231. I think there are places that are bigger than us. There are places that are smaller than us. And I think people are just going to have their challenges, and we have to do the best we can based upon what we have. So, I mean, I think that's part of this process, is working through that and getting people's input and understanding and ideas. So that's where I am with it.
Okay.
We want to keep encouraging that too.
I mean, I kind of have another question on if we don't do that one-way traffic flow, like in the front door, out the back door. I don't really see how we can manage the crowds that may come into the lobby of the town clerk's going out into the hallway. Because even normal times, the lines quickly stretch and then they're out the hallway, and you can't get back out the door without touching somebody, let alone distancing. So, I mean, I don't know if any thought's been given to having that move to a different area, like town hall or something, where you can spread it out more, or and then it's kind of. Mm-hmm.
So part of this process too is looking at other locations that we could potentially use as satellites to do certain things. And I think that is also in play. I don't know, I don't have an answer for you in terms of like what would be best. I mean, in Parks and Rec, we talked about using the senior center as a satellite office to do certain things, presuming that it's not going to be open to the public, you know what I mean, for congregating and elderly meals and things like that. You know, so that's a potential workspace. The town hall small room across the street to the right is a potential workspace. So there are ways to kind of spread things out a little bit more, but you know, that's probably one of our toughest things is this one-way traffic deal and how to deal with that. And we're just going to have to, I think, put the signage down. And I don't think there's a definitive answer to that yet, but it's something that we're working on.
Okay. And my other question was on specifically kind of to our employees and the TV side. Right now, we just have 4 desks that are pushed up against each other. And, you know, kind of there's some distance there, but there aren't barriers or anything like you see in the town clerk's office or greater space that you see in other offices between desks. And I don't know, like, what's the process of going about evaluating how best to set that up, but also the process of either the funding or to buy additional dividers or spread out into other rooms in the town hall. I'm not sure really how to proceed with that.
Mm-hmm. Yeah, I mean, I think my answer to that is it just begins with a workplace assessment, kind of looking at what you've got, using the basics of the 6-foot rule and, you know, within the 6-foot rule, and looking at those sorts of things and sort of evaluating how much of an issue it actually is. And then it's almost like a classroom in my mind. You have to look at your desk space and can you spread out, how far can you spread out within your workspace? And that could be as easy as having DPW come over and sort of do some furniture rearrangement to get you far enough apart that you're still functioning the way you want to, but you're physically distanced appropriately. That would sort of be my first thought. And then if you feel like that can't really happen, then maybe you look at things like spit shields and separators and stuff like that. That would be my thought. The other piece is obviously a rotation system, because EXTB is a little unique in that you guys have a lot of part-time employees. So, you know, you could stagger your schedule to have the least physical impact on that workspace. So bring in certain people at certain times and other people at other times.
Okay. Kristen has her hand raised.
So I just wanted to request, I know you had said getting additional sanitizer, but if we could have wipes for the copier and for the bathroom, that would definitely make me feel a little more comfortable. And then I wonder how these changes will be implemented for meetings, or is the plan to just continue meeting virtually?
Public meetings?
Yes.
Yeah, public meetings are a whole different animal, and that is an area where the New Hampshire Municipal Association is really leading that conversation with the governor. So the way the communication is working is the cities and towns are going to NHMA and raising the issues they think are important. And then the NHMA is bringing that to the governor, and the governor is working with us to, you know, make accommodations that make sense given the public health scenarios that we're in. So even though we may open up to a more accessible, if you will, building and the public to some extent, like appointments and so forth, I think the public meeting part of that is going to trail, and that we're probably not going to see public meetings in any form other than Zoom and I think that's a good thing from my perspective. I think that makes sense. And probably not until the fall, I would say, if then. You know, it may even go a little longer than that.
Kristen, as far as the wipes for the copy machine, I have a supply of wipes and Lysol here in my office for anyone that needs it. We kept it here in a central location, so back when the offices were open, the public wouldn't just take them. So anybody's welcome from any department to come get that, and then once my supply gets low, I'll contact Jeff and get some more.
Yeah, I think it would be helpful if there could be, especially if the bathrooms aren't open to the public, if there could be a container in there.
I see Andy has his hand, Darren and Doug still
Yeah,
have their hands up.
Doug is next in the line there, I see.
Just a question for Russ and Donna. In your discussions, and have you discussed a time frame for this? To open the town offices like the other communities have? Have you discussed any, June 15th, June 20th, or whatever?
Yeah, well, yeah. So we've discussed it a little bit in a rough sketch, and I think what I'd like to do is to try to have a plan formulated that includes, there's a couple things that need to happen. One is, the first step is I would like to have everybody coming out of this meeting, just give me whatever feedback you have by Friday. You can do that through Donna. You can get it to her as well. So just reading through this plan and things that are coming to your mind, kind of thinking about that, and getting any physical improvements that you think of beyond what we have here, make sure that gets on the table by Friday, as something to look at. So that way we'll have all the feedback, and then the intent is to take that and work with DPW and work with James Murray and so forth, and try to get a sort of a final look at what that would be, and have everything sort of in a draft form, if you will, sort of a final draft form by June 15th. I would like to do that. Then we'll know what the advice is from the governor on the stay at home on June 15th, what will happen. And that obviously makes, that's important. And then we've just tentatively talked about July 6th as a date, because it's after the July 4th holiday, which I think is a Friday this year, because the 3rd is on a Friday. So the intent would be like the new 2.0, if you will, for us would be on July 6th. So if we get something into place, it would be then. Okay.
One more question for Bob. Bob, are you looking for a co-anchor?
Sure. I have 2-person sets like this, so.
Okay. I'll be there tomorrow.
Bob and I have a meeting afterward. That's going to be the new select board set.
Yeah, sounds good.
Cool.
Darren has his hand raised next.
Yeah, I had 2 comments. One was about the copier. I know this won't work for everybody, of course, but even when I put out the application for the temporary outdoor dining, even when I wanted the plans, I required scans. So I've gone 100% electronic. I won't touch any paper. There's no need to. And as much as people can do that, I don't think it's our responsibility to provide the technology to any customer or citizen. So I think that as much as we can require people to send you things electronically, just cut down the paper anyway. And the other thing is Dave had a pretty good idea about how to combat the fact that we really can't use the back door and have people understand where to stand before you go past somebody. But in terms of a lot of people coming in, can't we do the same thing that that a lot of the stores were doing or are doing, where we have those 6 feet markers, say down the stairs, down the ramp, or whatever on the outside, so we only have so many people in the at least the clerk area anyhow.
Yeah, those are the things I think Pam mentioned we're ordering. So we have to figure out how we will put them on the floor. And like I said, we use that, the banker's rope concept. Like, we'll talk about different ways to sort of cordon off different areas to promote as much as we can, sort of people avoiding one another. So that's all part of the plan.
Andy has his hand raised.
Yeah, I mean, I'd like to congratulate the people that managed to successfully work from remote out of the office. It's not easy, and they did a great job. I don't know what we're going to do about that in the future. All the accounts are good for a whole year, and I have plenty of accounts left still. So that's one thing. The other thing is, if you need a webcam, which I do, there's 5 more in order. They're very hard to get. As soon as they come in, they get all snapped up. So if you need one, be on the lookout for an email, and I will give you first come, first serve.
Okay. Thank you. Yeah, and there's no plan in place for remote working at this point. So we're sort of evaluating some of the things that go with that. But I agree with Andy. Everybody's done a great job with the circumstances. So thank you all.
They're open anyways. It's not.
Yeah, because I was kind of going to ask a follow-up question along those lines is if when we're opening, like are we going to get guidance on what are the expectations? Because I know a lot of us have been either working from home every other day or different setups depending on your department's needs and stuff. So I would assume, I guess that stuff would come out when we're making some official plan for reopening on what the expectations going forward are.
Yes, I think we can address that. Again, we have not had a formal remote work from home type policy in the past. I think, my comment on that is that it's not an easy thing to develop, and it's not an easy thing to enforce, and it's not an easy thing to, I've seen sample agreements where there are a number of restrictions that are put on employees that work from home. And, I'm not sure we have the capacity to deal with all of those types of things. So that's sort of where I am at the moment. And I'm looking at it through the lens of trying to get us back from where we were and back into that space. So we're not looking at anything different at this point other than trying to get back to our business as usual as much as we can.
Alrighty. Leanne has her hand raised.
Yep. Just a couple of observations, possibly to keep people, adjust the elevator to only go to mezzanine and not to the second floor. That might help the flow of people going upstairs, and possibly make the upstairs bathroom employees only. That could be opened and closed with our key cards, just like the back door. Just a thought.
Thank you. Very good. We'll look at that. Yeah, my initial reaction to anything dealing with the elevator and stopping it from where it needs to go is I think of that in more of the ADA requirements and making sure that we're not overstepping in that regard. But I think given the situation, maybe we can tweak that. So we'll look at that. Thanks.
Kristen's up next.
My question is really just for Doug. Doug, if you are meeting with people, will you be bringing them back to your office?
Yes. Yes. In a safe manner, obviously. Both of us, whoever I'm meeting with, obviously would be wearing a mask, and I would be wearing a mask. If I can meet somewhere else, like if it's going to be a long discussion, I would prefer probably to meet down in the wheelwright room with somebody, that we have the ability to clean up after or wipe down. I certainly would be agreeable to long conversations with people and meeting downstairs. But just for quick questions and stuff like that, I probably would, but I can also go out into the lobby and answer their questions as well. So whatever is the safest way, I will take that route.
Can I add to that? I do keep a schedule for the wheelwright room. So if anyone knows that they're going to be having meetings in the wheelwright room, if you can let me know. As far as the elevator goes, I've obviously had some welfare clients who are in wheelchairs and need to get to me that way. I could meet with them in the wheelwright room, so that's not a problem. But we do need to make sure that the schedule for the wheelwright room
We could just listen, and you know what? We can just go up there and say.
I'm sorry, Andy?
Me?
Okay. Did you?
I missed that last piece by Pam.
Oh, I just said that if we could please keep the wheelwright room schedule going, that would be helpful.
Yes.
Yeah, I was gonna kind of add to that. It used to be set up this way at one point. Maybe it still is with the Wheelwright Room calendar. If you're doing it in your Google Calendar, I'm guessing there's a way that everyone else can add that calendar, or you can share it. So if we wanted to make that the way to go forward, we could maybe Andy and I could maybe help with people adding that calendar to their own one, because that way I know I have the Novak Room and Wheelwright Room. I have the Town Hall and all these other things, so I can see on my own calendar when it's already taken, so I won't request the time that someone else already has. So, and kind of, that goes along with what Darren was saying about digitizing stuff. There's a lot of stuff we can use the Google G Suite for with Google Docs and Google Drive and the calendar to, interact with each other digitally on there. So.
But I think we do prefer to have one central location as to who's going to do the scheduling for the Wheelwright Room, rather than just having other people be able to plug their names in when they.
I think the way it would be set up, it's still your calendar, but just other people can see it, so they can't edit it or anything like that. So request would go to you, obviously, and then when you put it in, it shows up on everybody's, so they can see when it's free or taken. Em, you had your hand raised next. I don't know if it was because of that or if you had a question.
All right. Looks like anyone else have anything pressing that they want to talk about, or just have any other questions? Okay. Well, thank you all. This has been fun. We should do this again. This isn't bad. I was actually wondering how this was going to work, and now I have my answer. Everybody's doing great. So I just wanted to say, with the chance with all of you here, just to say thank you for all of your efforts over the last few months. I've seen many of you in person, and we've talked in various ways, but I know this time period hasn't been easy on anyone. Those of us that have families and kids in school and elderly parents and the gamut, right? And it's a tough time out there in society right now. There's a lot of turbulence. We know that, right? But everybody's been doing a great job keeping us going in the right direction. So I really appreciate all the work that you put in over the last couple of months, and always. But in this very odd environment, I think people have risen to the challenge, and as things move forward, hopefully things will get better, and we can move ahead together. So thank you very much, everybody. And we'll catch up.
Thank you.
All right. Thanks all. Have a good day.
Thank you, you too.
Bye.
Russ, if you're still on there, I just wanted to let you know that the way I'm doing this is how in the future, if it was ever needed, you could do those kind of hybrid Zoom, no back room meetings, kind of. Because basically I'm using the studio equipment to film, what could be in the Novak room. And
Office.
oh, was that Dave with a question?
No.
Oh, yeah. So I just want to, it could be something in the future, but I would definitely prefer to have them stay on Zoom for as long as possible, because the need to clean equipment and all that stuff would be, I think, unnecessary. But it still surprisingly works well to do this kind of hybrid thing. But I'm sure you have your own concerns with it. But I think Zoom has worked really well, and we have a good workflow for it. So. But
yep, I agree. I was actually just talking to someone the other day about how Zoom for public meetings, it would be great to see that become an alternative under 91A, like an option if you wanted to do one that it complied with the statute. So that's something I'm throwing out there to the managers listserv to see what feedback is out there. But I think it makes all the sense in the world. In a lot of ways, you get more public access through Zoom than you do a Novak room that has a limiting factor for physical involvement, So good point. All right, all. I'm signing off.
See ya.
Have a good day.